So Doug's an extraordinary person, investor in Startup Health. You've been a great supporter from the beginning. Founder of RippleWorks, which I think is just an extraordinary mission that you all have. Do you want to share your vision with what you're doing?
Yeah, RippleWorks is my fifth startup. And there's something I learned in all five, and that is if we're lucky enough to get from product market fit to scaling stage, the number of people that have actually sat in our seat and experienced scaling is about this big. And so finding experts who have gone from small to big is a really hard thing to do. And as a CEO, you have no degrees of freedom to make mistakes, and you know you're reinventing a wheel that someone else had already invented. So RippleWorks was created out of that experience, is to help CEOs find shortcuts and scale faster. And we found a way to do that in that we tapped into a resource that we have failed to tap into around Silicon Valley. There are hundreds, if not thousands, of people who want to give back and make the world a better place, but haven't figured out how. And so RippleWorks connects those people who want to give back, who are in the prime of their career, to help these CEOs solve very specific problems.
Extraordinary. And you're working with companies all over the world at this point?
We are. About 20% are in the United States and 80% are rest of the world, about 39 countries now. And we help companies in healthcare, in education, in clean tech, and in financial inclusion.
And what's the profile of a company that might be at the right stage, the right moment, where they can really collaborate with you and they can get the most value and you feel like you're also able to add the most value?
First is the CEO. The CEO has to have a social belief in what he or she is doing. Still for profit, still to make investors a lot of money, but they're there not to get a fancier house on the Upper East Side, but to actually do social good. From there, it's about moving anywhere on the hockey stick of growth. You could just be at the beginning of it, or you could be at the advanced stage of it. But the key is that you've achieved some level of scale. You've moved past, will the product have acceptance, to, oh my God, the product has acceptance. Because that's where all of our experts can provide the most help.
So, serial entrepreneur, what's different about what you're doing now than maybe you've done in the past?
Probably the biggest difference is 100% positive social impact. So in all the other businesses, they had social indirect benefit. eBay building marketplaces to let little person compete with big person. eLoan breaking open the black box of fees so that we could have an easier way of getting loans and make it cheaper for all of us. Shutterfly to share life's joy through photography. Shopkick making shopping more personal again. But those were all indirect benefits. Now, our measure of success is 100% the success of the company and the social mission that they're on. So like in healthcare, great company in Brazil called Dr. Consulta. Dr. Consulta has figured out how to make healthcare affordable in Brazil with clinics that are almost like the Southwest Airlines of clinics. They're repeatable, they're affordable to build, and they're profitable quickly so that you can scale. And so they're offering same day, next day service affordably, and they're revolutionizing healthcare. They were afraid their EMR system and everything and all the technology was going to break. They didn't know where and when. And we brought in an expert who had been the head of technology for Walmart, head of technology for Shutterfly, just built a company that was acquired by Blue Bottle, and helped them work through their technology to understand when and where it was going to break and to help them redesign it.
What are some of the common issues that you're seeing founders today make, could be in healthcare or others, as they're just getting going, that you wish, oh wow, if they had someone to tap them on their shoulder and help them a little earlier, they might avoid? What are some of those things patterns you've seen?
Yeah, probably one of the big patterns I'm seeing in early stage companies is that they think the technology is cool and they let the technology drive the solution versus understanding the user need. And technology is simply an enabler, and we fall in love with our own technology. And we got to slow down on technology. We got to speed up on technology, slow down on that being the solution as much as understanding the user need. That's the first one. The second one is we've romanticized entrepreneurship to think that it's a lightning bolt moment. That all of a sudden the lightning is going to strike and you're going to have the perfect idea. And it's not. It's months and sometimes years of struggle to have that lightning bolt moment. So stay calm and keep iterating.
So RippleWorks is doing these extraordinary things to support these emerging companies, companies that are scaling. What's the process? Where should they go to try to get involved with you?
Yeah, so all of the companies we work with are referred to us by their investor. So if they're a startup health portfolio company, we would sit and talk with you, like we did last week in New York, and you would recommend to us, or that the portfolio companies can come talk to you and say, I'd like to be considered for a RippleWorks project.
I love the mission, I love the concept, and I love what you're doing, and I just got to thank you again for being so supportive from the early days of Startup Health. It's meant a lot to us, and we greatly appreciate it. So thank you.
I love what you're doing. Keep it up. This is how we will achieve those moonshots and change the world with the work of Startup Health.
Thank you so much,
All right,
Doug.
man.
Thank you.